Hello, in this video we will discuss about the terminology of position. So that is very easy to understand and very easy. So you can understand the anatomical position. So anatomical position we will learn here through diagram of the person. So in this way, I am drawing the person for the getting the cross section by the different angle for understanding their internal structure, internal anatomy. So that is why we use the anatomical position. So the anatomical position is here, the medial, this is the middle line, while this is the lateral line, and this is the distal to proximal from hand to shoulder, and this is the proximal, distal to the proximal. So the distal to the proximal, from feet to the leg to the upper body. What this we can explain via this terminology in a medical for medical student. And this is the superior rostral area is the here, and this is the posterior dorsal and the anterior ventral, while the here is the dorsal side of the hand and palmar volar side, palm side, and this is the dorsal side of the feet and the ventral, the palantar side, because the palantar because uh, so here is you can see the coronal section. The coronal section show a lot of the information. On the other hand, the coronal section is the down to the inferior or caudal side. So in this way, here you can see this is the horizontal plane, and the horizontal and the middle plane you can understand also the basically the medial. So this is the sagittal, basically is the side is the sagittal plane, while on the other hand here you can see this is the superior move from shoulder to the neck, and here is the anterior ventral and the posterior dorsal cross section side line, and this is the inferior to the horizontal here, and this is the basically coronal. This is the horizontal and the coronal and the transverse plane we can understand through it. And here is the coronal plane, and this is the sagittal plane. So the sagittal plane and the coronal plane and the median plane, we are watching the person from their upper side, from the roof. So remember, and this is the sagittal this is the proximal and distal side of the arm, and this is the leg, which that is the proximal to the distal side. So the distal is away from the body and the proximal toward the body of the leg, and this is the fibular and tibial movement, and the basically you can understand, and the this is the sagittal plane. The sagittal plane is here, and this is the medial and lateral rotation. This medial and lateral rotation of the arm. So anyhow, this is the basically the median plane. Let's begin to understand the terminology of head. So the head terminology we can understand. So let's begin to understand. Here is the terminology of head. So I am drawing the head. So in this way, here is the coronal suture. This is the frontal bone, and this is the sphenoid bone, and this is the nasal bone, and this is the zygoma, and this is the mandible. So this is the showing the position of the face, and this is the mental protuberance, and this is the premaxilla, and this is the malar process of maxilla, and this is the maxilla. This is the superior orbital ridge. So anyhow, this is the side view of the head, which that's contain here is the squamosal suture, and this is the basically the forehead. This is the nasal region, nasal bone region, and this is the premaxilla, and this is the maxilla, and this is very important is the basically mortal protuberance and the parietal head, and this is the occipital, and this is the hind head, and mastoid, because the mastoid bone containing region is near the ear. So let's begin to understand the terminology of moves. So let's begin. Here is the I am drawing the basically the terminology for moves is simply to understand, because I am not going to hold detail, but this is the flexion. The flexion means the contraction, but the relaxation of the muscle is the extension. So on the other hand, there is the abduction and the adduction. So this is the elevation and the depression of the head. So the elevation when will move up the head. On this way, here you can see this is the movement of the feet upward and downward is the dorsiflexion and the planar flexion. On the other hand, this is the inversion and aversion. This is the inversion and this is the aversion of the feet. So I hope you make sense about the terminology of position. This video about the terminology of position, anatomical view. So thanks for watching. If you like this video, please make sure to subscribe, like and share. And also check another video for understanding more physiology and anatomical videos related to the disease. Thanks.